Hello, today I wanted to explain about the functional tool that I chose, which is C-reactive protein test, which is known also as CRP. And it basically measures the level of C-reactive protein that is in our body by a blood test. So this protein is produced by the liver, and depending on what the result is, the higher the level, the higher it is that we might have a disease caused by inflammation in our system. So, this is what basically the test is for, to measure inflammation in the body. And the normal is that we have this level low. So that is always a goal with this test. I also wanted to talk a little bit more about inflammation and how it's like our body's response to protect our tissues and help us heal during any kind of situation that puts our body in danger. It could be as little as a cut and how it turns red, and then how it's a little bit inflamed and then swells a little bit, and then it starts its healing process, because that's what our bodies are meant to do when we have those situations. Inflammation can be on the outside, but it also can be in the inside, and it can be leads towards something more chronic, as a chronic disease, which is going to obviously go into more health issues if we don't treat it appropriately and at the time that it's happening. So this is why the CRP test is very helpful, because it's going to tell us how much inflammation we have, and if we have inflammation in our bodies, because sometimes we don't perceive it as something like on the outside, so we perceive it during this kind of test. And the only downfall about this test is that you don't know which body part specifically is the one that's causing the inflammation, neither the cause of why we have this inflammation in our body. We just know how much is what we are having and if we have it. So, what this test is used for is basically to monitor and to find that inflammation in our body. It can be used for diseases that are causing infection or certain viruses. It can help us with irritable bowel syndrome and Crohn's disease, which is something that we've been talking about in previous discussions. It can also help with autoimmune diseases like lupus and pulmonary diseases like asthma. So that is very helpful to know and to keep monitoring these types of diseases, which is very, very important. Another reason your provider might be recommending this test to you is because you might have a bacterial infection. Some signs and symptoms can be fever, it could be rapid heart rate, rapid breathing, or even nausea and vomiting. It can also be for more of a chronic disease, to also help monitor or to find if it's related to. And the signs and symptoms do vary depending on that disease. So it is all provider indicated that you would need this test. And the process, or what is expected to happen when you take the test, is that you get blood drawn from your arm, from a vein in your arm, and then it takes like less than 5 minutes to take this test. The risk you might have doing this test is maybe it might hurt a little bit, it might sting a little bit, it might even like cause a little bruise, but the signs, the symptoms go away quickly. So there's basically no risk when you take it. When you do any kind of test, there might be some sort of risk or some sort of unexpected thing that can happen, but it is very low chance that that'll be happening with this kind of test, since it is very easy and takes less than 5 minutes to do. And to prepare for the test, it is basically asked to you to not do any vigorous or extreme or intense physical activity before going to the test or getting the test taken. Also, another thing is, depending on the medication you take, usually things like aspirin, ibuprofen, things that might react with the CRP is usually not recommended to take before the test, since it could alter the levels. And yeah, those are the major considerations to take before taking this test. And the results are usually compared and evaluated by the provider, and he's going to take this information, or she's going to take this information just based on the levels. Like I said, if it's on a high end, it's because there is inflammation in the body. However, it's not going to say where and why, what's causing it, simply that it's there and the levels are high. And if it's on a lower level, then basically there's no inflammation and you're good to go in that aspect. The range values of this test is higher than 8 or 10 milliliters per hour. That indicates that is a high level, and below 8 is what we consider a normal level to this test. There are some tests that I wanted to mention also that are kind of in comparison with this test in regards of inflammation and how it's affecting our body. Is the PCR test, which does the same kind of functions as the other one, as a CRP, but also includes infections like sepsis, which, as we know, it's really harmful for our body, and it's an extreme infection that we basically can recover or may not recover from it. So it also measures that kind of infection and helps monitor as well, and it's a little bit more effective, seen by studies. So that is another one that we should keep eye on as well, if we want to have like another biomarker of how much inflammation is in our body. Another test that I wanted to mention is the high sensitivity C-reactive protein test, which, like the name says, it's highly more sensitive, and it can like get more specific concentrations or increases in these protein levels, and can actually help us with like the other infections, the other diseases that I mentioned, but it can also help out to figure out about coronary diseases or possible heart attacks that can happen due to inflammation. So that is another helpful and more complete kind of test, in my opinion. So yeah, the CRP test to me is a little bit more standard. It's cost effective, it doesn't take that much time, it gets you results even though it's not super specific, but it does the job. But these other tests also help you out and to know certain biomarkers that we need or other functional tools that is going to be helpful to monitor and just to give in a better detailed diagnosis. And it's going to help our provider to be able to explain the disease more effectively to the patient. So I think 3 of these or all of these tests are super beneficial for us and as providers, as healthcare providers, and also to the patients, just to keep them more informed and to keep them just really like get a sense of how their levels are regards to inflammation.